This video is made to help kids and youth, including those with disabilities, help prepare for the dental experience. But really, this video can help anyone who may experience dental anxiety or visiting the dentist for the first time. We hope this video helps you, and if you have any questions after watching, please ask your dental team. Today is 1 week before Sarah's dental appointment, and today she is coming into the dental office to see how things will be and to know what to expect. When preparing for the dental visit, the dental team is always happy to see you and show you around the dental office. This can be helpful to get an understanding of the dental surroundings as well as meet the dental team. If you have a favorite toy you'd like to hold while at the dentist, you are more than welcome to bring them along. We can show you how we look in their mouth to count the teeth, and you can try it too. If noise is bothersome to you, you can bring some headphones to listen to music or cancel out the sounds. We will just ask you to keep it low or to have one ear out so we can still talk to you and check in during the visit. Other things that may help during the visit and when preparing can include bringing your favorite weighted blanket or sleeping bag to help you stay calm and still during your appointment, visual schedules to review the steps of your appointment, reading stories about going to the dentist. For example, Dora and SpongeBob both have great dental stories. Write down any questions you may have or anything at all you may be worried about or want to know before your visit. We'll be happy to answer any and all questions you may think of. Today, Alex is at the dentist for his checkup. Someone from the dental team will come get you when it's your turn to get your teeth checked. While waiting, you can read or color. You follow them into the room and get into the big, comfy chair. They will help you put a napkin around your neck to keep your clothes clean and dry, and some sunglasses to protect your eyes from the light. Then lean you all the way back. Before the dentist starts, they can show you how the tooth counter works on your fingernails. Then the dentist will ask you to open nice and big. With their mirror and tooth counter, they will check every tooth. After the dentist has finished counting all the teeth, they may decide we need some pictures. First, we put on a weighted apron to keep you safe. To take the picture, you open wide, and then when told to, gently bite down on the x-ray and stay still like a statue until the photo is taken. Now we have pictures of Alex's teeth, and we can look at them to check for sugar bugs and cavities. After the x-rays, Alex comes back to the dental chair for his cleaning. Alex stays still with his mouth open wide. We use a special tool that is great at removing sugar bugs to help prevent cavities. Lastly, we put a sticky gel on all your teeth that we call fluoride or tooth vitamins. Fluoride keeps your teeth strong and helps prevent cavities. The fluoride may feel sticky, but it tastes yummy. Ask your dentist if you can eat and drink right away afterwards, or if you have to have a wait to let the fluoride work. Alex did so great at his dental visit today. The dentist will recommend when Alex comes back depending on whether he has cavities and how clean his teeth are. Today, Sarah is here to fix her cavity with a filling. The dentist will be wearing an outfit that may make them look a little bit different than normal. They wear a mask, gloves, funny-looking glasses with a flashlight, and sometimes wear a covering dress and a shield over their face. If you want your parent or caregiver to stay close by, that's okay for them to stay in the room with us. We just ask that caregivers be silent partners and ask them for help when necessary. Sarah is putting on her safety glasses and napkin around her neck. Firstly, we lay Sarah all the way back in the chair. We may ask you to scooch further up so your head is on the headrest. Sometimes dental offices use something called the silly nose that gives you happy gas to help relax. The dentist will tell you to take big sniffs like you're smelling flowers or fresh baked cookies. If the dentist uses this and you feel unsure about it, you can always ask to take a silly nose home to practice taking sniffs through it. Even if you aren't using the happy gas, it's still a good idea to take big breaths to help you relax if you are nervous. Next, we need to put Sarah's tooth to sleep. We start by putting numbing jelly on the tooth. There may be different flavors to choose from. To help keep Sarah's mouth open wide, we use a tooth pillow. It goes click, click, click. This help keeps your mouth open. When we put the tooth to sleep, you will feel a little poke, but it doesn't last long, and it's important for you to stay extremely still. Sitting on your hands can help make sure you stay nice and still. Next, we need to put on the tooth hugger. Then we will put on the raincoat to keep the tooth nice and dry. When we put the raincoat on, it might be tricky to talk, so we will make sure we have a code if you need to take a break or say something. A thumbs up or down or raising a hand can be good ways to communicate with your dental team. Sarah's mouth may still be wet, and we have the perfect solution: tooth vacuums. One of them looks like a straw and sounds like this, and the other is stronger and sounds like this. Now that the tooth is asleep and dry, we clean off the sugar bugs with our special electric toothbrushes. This is what the electric toothbrush at the dentist will sound like. If the vibrations feel a little bumpy, that's normal. It is important to be a good helper by staying very still during this part. But if you need a break, just raise your hand. Once the sugar bugs are cleared out, the dentist fixes the cavity with a filling to make your tooth back to normal. There may be many different ways that we might use to fix this cavity. They may use something that needs to be shaken up first, and sometimes they use a bright blue light. And sometimes we might use silver caps. We will have to find one that fits just right, just like a perfect fitting shoe. Now that the filling is done, the raincoat comes off, and we either tell Sarah to close gently or to bite down hard. The dentist will make sure the teeth all touch the same as before. The filling is all done, and Sarah did wonderfully. Sarah can hardly wait to tell her friends about her special visit and what a good helper she was. Now that Sarah is done with her appointment, she notices her lip is feeling a bit tingly and different. This is a normal feeling and will go away in an hour or so. Oftentimes, our lips will stay sleepy from the sleepy juice a little longer than the appointment. While we wait for our lip to wake up, it is important not to bite on our lips or eat or drink hot foods or liquids. Now is a perfect time to have ice cream, yogurt, or pudding. Hooray! Alex is about to brush his teeth. He brushes them at least once in the morning and once at night. When we brush our teeth, it is important that we get every surface of every tooth. We want to brush the outside, the inside, and the tops of all of our teeth. We want to take our time to make sure we get all the sugar bugs. Alex places a pea-sized amount of toothpaste on his toothbrush and turns on his 2-minute timer, which could be a favorite song. Alex spits out the toothpaste into the sink and he is done. It is also normal to need help with brushing our teeth to make sure we clean every tooth. Our caregiver can help out with this. Alex now has some teeth that touch each other, so it's very important to learn how to floss to get out the hidden sugar bugs. Alex takes some floss and wraps it around both pointer fingers. He then opens his mouth and flosses one tooth at a time, making sure to get between every tooth. When flossing our teeth, we make a C shape with the floss and hug around each tooth, moving up and down 3 times. If wrapping floss around our fingers is challenging, we also have these great flossers that make flossing even easier. Alex did so great taking care of his teeth, and Spider-Man is his favorite. So as a reward, his mom gives him a sticker to encourage him to continue a good job with his oral hygiene. We also have some other brushing and flossing substitutes that may help with brushing and flossing. First is a bite block, which will help us keep our mouth open. We also have a 3-sided toothbrush called the Collis Curved Toothbrush, which can help us get all surfaces of all of our teeth more efficiently. We also have these gum checks for flossing. The handle may make it easier for you to handle the floss. And finally, if flavored toothpaste is not for you, there is also non-flavored toothpaste available.